Millions of Americans are receiving or have already received their free rapid COVID-19 testing kits in their mailboxes from the federal government.
Western Mass News reporter Amanda Callahan is getting answers from a local health expert on how to make sure you get the most accurate results.
The federal government launching a new program last month to help combat the coronavirus. Anyone who lives in the U.S. can now order 4 free at-home rapid COVID tests on the government website covidtest.gov. Those shipments rolling out now as some people have already received their kits in the mail and others still waiting. Western Mass News checked in with the United States Postal Service to see how the delivery of these tests is going. A spokesperson tells us in part, quote, since covidtest.gov launched formally last week, approximately 60 million households placed orders for their free tests. Already, tens of millions of tests have gone out to households around the country.
When companies make these things, they do realize that stuff has to be shipped. And so even though a package may say store at room temperature, there is a little bit of leeway in there.
Erica Hamilton, a microbiologist at UMass Amherst, addressing concerns many are having in terms of making sure these tests are accurate. She tells Western Mass News concerns over these tests being exposed to cold temperatures is only one factor potentially impacting results.
Following the instructions and doing the test correctly is more important for you getting an appropriate result than it sitting in your mailbox for 12 hours in the freezing cold.
Expiration dates are also something you should pay attention to when your tests arrive.
There's a difference between a couple weeks with a at-home COVID test past the expiration date versus 6 months. If you got your free at-home COVID test and you don't need it and August rolls around and it's well past its expiration date, you should probably consider purchasing a new one or getting a new one.
And built into these tests is the most accurate way to ensure your result is good.
When you do the test, this is what the orange one looks like. You'll see that there's a C and a T on it. The C stands for control. That control on your test is there to tell you 2 things. One, that the test worked properly. And second, that you did it properly.
Amanda Callahan, Western Mass News.